Hi there. In this video, I want to talk about medial knee pain. Hi, welcome back. This is Elbu, your exercise physiologist. So now that we are a bit more specific, we want to zoom into the pain that's around your medial side of the knee. So when we talk about the medial side, we're talking about this area. Okay, so this is my right knee, and we're talking about the inside of the knee. So my drawing is not the best, but let me just illustrate to you. When we're talking about the medial side, what are the possibilities that can give you problem? So this is looking from the medial side of your knee, and different color represent different things, and I try to mark them with different colors. So the one that you see in black is your bone. This would be your femur bone, and that would be your tibia bone. Okay, and the red one represents your quadricep muscles. This particular one that's coming to the side is what we call the vastus medialis. Okay, and we have the adductor group muscle, which is the blue one. And then we have your hamstring group muscle, which is the green one. Okay, so all of these muscles or group can actually give you the sensation of medial knee pain. So for quadriceps, I mentioned vastus medialis. Adductor, most of them actually ends up here, so I'm not gonna separate them. We probably can only find out when you do a series of tests. For your hamstring group muscle, the one in green, this would be more the semi-T, semi-tendinosis, the semi-M, the semi-membranosus, that it's coming to the side of the knee, and it actually ends up somewhere in front of your knee. Okay, most people who have got hamstring problem can sometimes feel the medial side of the knee. Okay, so I always say, if you track, you will know which muscle is giving you the problem. So I will need you to feel your own knee and to make sure that you're feeling the right part of the knee. Okay, so as you can see, this is my beautiful knee joint. So what's happening here is that I've actually marked out with the same color of marker, so that you can actually now visually look at what's on your knee joint, and you don't have to be referring to textbook or even websites. Now just look at this own video, look at your own knee, and then make sense of it. Okay, and I will try to show you, right? So if we talk about your quads, right? So this entire area is the quads, but this region is already your vastus medialis. Okay, so you will tend to realize that this muscle only gets to work when at end range of extension of the knee. Okay, somewhere around here, as you can see, I'm slightly bent. It's not activated. It's only when I try to fully extend, it starts activating. Okay, so that's your vastus medialis, and then come your adductor group muscle. So what's happening here is that I didn't go all the way up to where my thigh area is, just around the medial knee so you can see. And for this, it's really everything on the side over here. Okay, this belongs to your adductor. And when you talk about the medial knee, right, all this actually ends up somewhere here. So this is the medial of the knee, but I don't know which part of it that you have, so you're going to check on yourself, right? So adductor come from the side of your thigh, and from here all the way down to the side here. And for hamstring, it's kind of like a bit of intersection. Most of the bulk will come from the back, the back of your thigh. Okay, and I'm trying to show you here, so I increase this bulk here. Okay, if you were to try to flex your knee, you will feel this area being activated. Okay, so the semi-T, semi-M muscle actually comes to this side of your knee. Okay, so if we talk about the medial side, we can already zoom into which muscle is actually giving you the problem. So you got to be more precise, and then from there you can then check. Of course, the professional will be able to help you. So if you're not sure, you're just somewhere around here, you can try this few muscle. It's going to hit one of them. Okay, so what I mean by tracking is that when you feel your muscles, right, somewhere in the medial, right, you don't know which one, you just make sure you backtrack and see which one is giving you the problem. Sometimes it's not just one, sometimes it's multiple. So if you backtrack and you try to palpate, and if you can feel some sensation, and if you want to know the difference, try the other knee. Okay, it should give you a different kind of sensation. And for the hamstring, you can actually try to go from the back. Okay, so you have to feel it and to backtrack, right? So that's the middle part of the knee. So yeah, if you were to able to track which part of the medial side of your knee that's giving you the problem, and I just showed you the backtracking, so you can actually find out which is giving you the problem. Like I said, could be one muscle, could be multiple muscles. So try not to delay this problem, and if you don't know how to fix it, can't fix it, if you already know the problem, seek for professional help. Okay, this just shows you that it is your muscle that's giving you the problem. Okay, don't spend your money on MRIs, X-ray. Fix the muscle first. Make sure that you can find someone that knows his stuff or her stuff. Fix the muscle, and if the pain is gone, there you have it. Alright, so that's it for this video, and that's all I have for you today. Please take care and see you soon. Bye bye.